Hello everyone, welcome. In today's video, we are going to understand the knee joint anatomy, which is one of the most important weight bearing joint in the human body. The knee joint is a modified hinge joint type of synovial joint. Synovial joint are basically those joints which are enclosed by capsule and are fluid filled joints. Hinge joint are like the hinges in the door. You can see here in the picture, it is like a hinge in the door which allows the bone to move in a one place. It mainly allows flexion and extension, also small amount of rotation, especially when the knee is flexed. It is a weight bearing joint and it plays a crucial role in walking, running. Talking about the bones of the knee joint. Knee joint is formed of three bones, basically femur, tibia and patella. This is the femur and this is tibia, and the circular bone visible here is the patella. In this picture, the patella is flip off to show the inner surface of the joint. The knee joint is also called as the knee joint complex because it includes three articular surface which forms the two joints within a single joint capsule. Patella and femur forms the patellofemur joint. Similarly, tibia and femur forms the tibiofemoral joint. Tibiofemoral joint consists of distal end of femur. You can see from here the distal end of the femur and the proximal end of the tibia. The tibiofemoral joint has a great demands placed on in terms of both stability and mobility. The articulating surface of the knee joint are covered with the hyaline cartilage which covers the femoral condyles, tibial plateau and the articulating surface of the patella. This cartilage help in reducing the friction and absorbs the shock during the movement. It ensures the smooth and pain-free motion of the joint. The knee contains two menisci, the medial menisci which is present on the medial aspect of the knee joint, which is, you can see this one is the medial menisci which is C-shaped and less mobile. Similarly, on the lateral side of the knee joint is present the lateral menisci which is more circular. You can see this is more circular and is more mobile. The functions of this meniscus is shock absorption, load distribution and joint stability. Clinically, the medial meniscus is more commonly injured. Ligaments of the knee. The stability of knee is mainly provided by this ligament. There are two categories of the ligament present. First is the intracapsular and second is the extracapsular. These intracapsular ligaments include ACL, that is anterior cruciate ligament, which prevents the interior displacement of the tibia, and second is the posterior cruciate ligament, which prevents the posterior displacement. Here in this diagram you can see this is the anterior cruciate ligament and this structure is the posterior cruciate ligament. Coming to the next is the extracapsular ligament. It includes MCL, that is medial collateral ligament, and LCL, that is the lateral collateral ligaments. These ligaments provide side to side stability. Coming next to talking about the joint capsule and the synovial membrane. The knee joint is surrounded by the fibrous capsule lined by the synovial membrane. This synovial membrane produces the synovial fluid, which lubricates the joint and provides the nutrition to the cartilage. Every time the knee joint is flexed and extended, the synovial fluid moves from one direction to another direction and it provides nutrition. Talking about the bursa around the knee joint. First, let me tell you what is bursa. Bursa क्या होता है? It is a fluid फिल्ड बैग लाइक स्ट्रक्चर. ये जो बैग लाइक स्ट्रक्चर है वो हर ऐसी जगह पे होता है जहाँ पे फ्रिक्शन होने के चांसेस होते हैं. तो दिस फ्लूइड फिल्ड बैग लाइक स्ट्रक्चर प्रिवेंट्स द फ्रिक्शन. जैसे बोन और टेंडन के बीच में जहाँ पे फ्रिक्शन हो सकता है, ऐसे स्ट्रक्चर्स के बीच में होता है और उस फ्रिक्शन को प्रिवेंट करता है. So, knee joint, around the knee joint, multiple bursas are present. Most important are suprapatellar, prepatellar, and infrapatellar. Here in the picture, I can show you this is the suprapatellar bursa, and this structure is a prepatellar bursa, and this one दिस वन इज द इंफ्रापटेलर बर्सा. देखो यहाँ पर भी जो सुप्रापटेलर बर्सा है वो फीमर और क्वाड्रिसेप्स के टेंडन के बीच में है. जो प्री पटेलर बर्सा है वो पटेला और जो सबक्यूटेनियस टिश्यू है उसके बीच में है. और दिस इंफ्रापटेलर बर्सा इज प्रेजेंट बिटवीन द टीबिया एंड द पटेलर लिगामेंट. इनके बीच में है टू अवॉइड द फ्रिक्शन. अगर इन स्ट्रक्चर्स में किसी भी वजह से इन्फ्लामेशन हो जाता है देन इट लीड्स टू बर्साइटिस. Muscles acting on the knee joint. Muscles around the knee are responsible for the movement. Quadriceps muscle is responsible for the extension, while hamstring muscle is responsible for flexion. Popliteus muscle plays an important role in unlocking the knee during the movement. In this picture, I can show you the different muscle. This is the quadricep muscle, and this is the gastrocnemius muscle, and this in behind the leg on the posterior aspect is the hamstring muscles, and the popliteus muscle is present on the posterior aspect of the knee joint, which is not visible in this diagram. Clinically, the knee joint is commonly affected by ACL tear, meniscal injuries, patellofemoral pain, and osteoarthritis. Understanding the anatomy helps in better diagnosis and treatment. So this was a complete overview of the knee joint anatomy. In the next video, we will cover the knee biomechanics, which will help you understand how movement actually occurs. If you found this helpful, don't forget to like, share and subscribe. You can ask your queries and give your feedback in the comment box below. Thank you.